Okay, sa wakas, last na ating WBC Patho video lecture series. So this time, ay didiscuss naman natin is yung mga different classification of your lymphomas. So, ginroup ko yung lymphoma according to affectation, no? So, unahin natin yung mga lymphoma specific for B cell. Next, yung specific sa T cell. And a type of Hodgkin's na applicable for both B and T cell, which is Hodgkin's lymphoma. Babalikan natin sa mga B cell yung chronic CL or chronic lymphocytic leukemia. Okay? It is actually not classified under leukemias. Lymphoma actually ang ating CLL, no? Medyo weird yung classification niya, so pag-uusapan natin to kasi nadadiagnose siya not using the bone marrow aspirate. Anong ginagamit in CLL? Lymph node aspirate yan or LNA. So ito yung kakaiba ng leukemia. So, babalikan din natin si hairy cell, multiple myeloma or MM, and Burkitt's lymphoma. Recall natin anong type of ALL si Burkitt's lymphoma. It is type L3, which has large and homogeneous type. Okay, next tayo with CLL. CLL is the most common leukemia in elderly. Okay? Ano ulit ang most common cause of leukemia in children? Yung ALL naman, the counterpart of the CLL. Okay? And in other books, ang tawag dyan is small lymphocyte leukemia. Based on the name itself, makaka-appreciate ka ng small lymphocyte sa peripheral bloodstream mo. Ano ulit ang size or cell na the basis of the size of your RBC will be the size of RBCs. Ano ang sabi ko? The basis of your lymphocyte cell will be the size of RBCs. Okay? Kapag magkasing size sila, ibig sabihin small lymphocyte. And then, since chronic yan, one of the criteria should be the blast numbers should be less than 20%. And since chronic sila, ang affectation na age group is elderly, so more than 50 years old. So, hindi to BMA, okay? It should be lymph node aspirate. Paki-correct na lang. In your lymph node aspirate, makikita mo yung mga etong characteristic. Number 1, soccer ball appearance. And then number 2, your smudge cells or the basket cells, which is the pathognomonic sign for your CLL. And makikita mo lang din to, aside from your aspirate, nakikita mo rin to in your PBS. So, tingnan natin kung anong itsura ng soccer ball and smudge cells under microscope. Sa CLL, no, kung makikita nyo itong mga to, di ba mukhang mga soccer ball. So, kung ito drawing natin yan, di ba, parang mga, ano ba mag-drawing ng soccer ball? Anyway, mga alternating black and white appearance sila. Okay? And then for in PPS, makikita mo yung smudge cell or the basket cell. So, mukha silang basket, right? Ito yung kunwari yung basket. So, kamukha niya halos. Nagkakaroon ng smudge cell kasi mga lymphocyte in CLL are very weak. No? Madali silang masira during staining methods. So, during right staining, nadidisintegrate sila agad-agad. So, ito yung tinatawag natin smudge na lymphocyte. Next is the hairy cell leukemia. Dahil sa pathognomonic sign niya na hairy cells. This is actually small B lymphocytes na may mga cytoplasmic projections na mukhang mga hair-like structures. So, kung i-drawing natin yan, no? Ito yung B cell. So, may mga projection from the cytoplasm. So, nagmumukhang hair sila. Hairy balls. Mga yan. And the special stain for this, para ma-appreciate mo yung ganitong structure, is the tartrate-resistant acid phosphatase or tinatawag natin TRAP test. So, for mnemonics, no, trap the hairy monster down. Nakuha ko lang to somewhere sa HAR or somewhere in other book Shula para mas madaling intindihin para saan ang trap sa hairy cell leukemia. So, under microscope, ito yung mga tinatawag natin mga cytoplasmic projections. Kaya siya tinawag na hairy cell. Okay? Next naman is the MM or the multiple myeloma. So, sa mga books ngayon, ang pangalan niya is plasma cell myeloma na. Dahil ang main cause of the cancer is the cancerous plasma cells. Okay? And kaya tinawag natin cancer, nag-overreacting yung plasma cell producing a lot of immunoglobulins or abnormal proteins. Okay? And these abnormal proteins can cause the following consequences. So, meron tayong mnemonics na CRAB. Hypercalcemia. Nagkakaroon ng hypercalcemia kasi yung mga antibodies or immunoglobulins, ang target niya are your bones. Okay? Releasing a lot of calcium. Pag nadurog yung bones, yung mga calcium deposit niya, pupunta ngayon sa bloodstream. Kaya merong hypercalcemia. And this hypercalcemia can also cause renal failure. So, nagkakaroon ng calcium stones, no? Nagkakaroon na ngayon ng destruction of your nephrons. Another is anemia. Bakit nagkakaroon ng anemia? Again, your bones are capable for RBC production, no? Lalo na yung mga bone marrow natin. Okay? So, kung nasisira ang mga bones natin, nasisira din yung production of your RBC. Kaya may anemia. And aside from that, another cause niya is the destruction of your nephrons due to your kidney failure. Okay, sa renal failure. So, wala kang erythropoietin. Kaya magkakaroon ka ng anemia. And, ayun nga, dahil nga mayroon tayong bone destruction, makikita mo yan actually in X-ray. Okay? Ang i-check mo ngayon, yung mga axial skeleton. Ano ba ibig sabihin ng axial skeleton? Titingnan mo yung skull, okay? Pati yung vertebra. And also the hips. Vertebra. And yung hip bone. So, yung mga gitnang part of the body or yung tinatawag ng axial skeleton. Anong itsura ng mga multiple myeloma under X-ray? So, sa X-ray, ma-appreciate mo to. Parang na-puncture. No, mga bilog-bilog yan. Actually, ito rin. Ito rin. Ito rin. So, tinatawag natin punch-out lesions. O, parang na-puncture. No, perfect circle sila. Okay, proceed tayo with Burkitt's lymphoma. The characteristic na makikita natin under microscope is the starry sky pattern. Mamaya papakita ko sa inyo ano ibig sabihin ng starry sky. Or drawing lang natin. Okay? So, ang starry sky na yan, merong drawing natin mabuti. Okay. So, yung ating background is dark blue actually. Tapos, yung mga lymphocyte ay may mga makakapal na cytoplasm. Okay? So, nagmumukha silang mga stars. Nakikita nyo ba? Actually, sorry sa drawing ko. Mamaya papakita ko naman yung actual microscopic appearance. So, ito yung itsura ng starry sky appearance. Yung ating mga lymphocyte has a lot of glycolipids, no? So, mas maraming cytoplasmic content na walang kulay. So, ito yung nagkakos ng star-like structure. Anyway, proceed tayo with the classification of your Burkitt's. We have 3 types. We have endemic, sporadic, and immunodeficiency associated. Sa endemic, pambata yan, no? 4 to 7 years old. So, akala kasi nila, no, nakakahawa yung sickness nito. Kasi halos lahat, no, bata yung primary patients. And the primary manifestation is jawbone mass or mandibular mass. Sa sporadic naman, both children and young adults. Ang difference naman dito, ang manifestation is merong bukol sa tiyan or abdominal mass. Okay? Sa immunodeficiency associated, Burkitt's lymphoma siya na na-form sa may mga HIV. Okay? Ito yung type ng Burkitt's lymphoma na very fatal. Actually, Burkitt's lymphoma is treatable except this type. Dahil marami siyang affectation, pwede siyang pumunta sa brain or CNS, central nervous system, your bone marrow, peripheral blood, and associated din siya with your EBV infection. So, prone ka magkaroon ng kissing disease. So, ito nga yung sinatawag kong starry sky appearance. Kung makikita nyo itong mga to, this is actually your lymphocyte na madami yung kanyang cytoplasmic content. Yung cytoplasm niya has a lot of lipids. And again, lipids are parang stain resistant. So, walang kulay yung kanyang cytoplasm. Okay. Next naman, ginurupo ko itong dalawang ito dahil parehas silang ina-affect yung mga T cells natin. Okay? Mycosis fungoides, from the name itself, no? Fungoid. Akala dati, fungal infection yan. Kasi mukha silang mga ringworm pagdating sa skin. Pero under microscope, walang nag-grow. Or under culture, walang nag-grow na fungi. So instead of fungi, ang problema pala nila is bagsak yung T cells nila causing your cutaneous lymphoma. Cutaneous siya kasi at the skin level lang. Okay? So sa skin biopsy, ma-appreciate mo yung potrier microabscesses. These are, ito yung skin, may mga maliliit na mga abscess yan. Sa Sézary syndrome naman, kapag ang MF mo or the mycosis fungoides kumalat na all over your body or nagiging systemic, ang tawag na doon is your Sézary syndrome. So, ito yung difference nilang dalawa. Ito, skin level lang. Sézary syndrome will involve your lymph nodes na din. So, may mga kulani ka na rin. No? And under microscope, makikita mo yung mga Sézary cells. These are actually lymphocyte. Di ba ang lymphocyte natin, ganito ang itsura. Okay? Big eccentric nucleus. No? Very circular nucleus. Sa Sézary syndrome, mukhang brain-like structure. So, paano ba ang brain? Parang ganyan. And may mga convolutions. So, pakita natin ang itsura nila under microscope. So, this is Mycosis fungoides. Ano ang pathognomonic sign ng Mycosis fungoides? These are your potrier microabscesses. And again, Mycosis fungoides affects only at the skin level. While your Sézary syndrome has the presence of the Sézary cells, mukha daw may mga brain convolutions, no? Mukhang brain matter. and ma-affect niya yung skin plus the lymph node. Okay, next group of lymphomas are your Hodgkin's lymphoma, affects both of your T and B cell. In WHO classification, we have two types. Meron tayong nodular Hodgkin's and classical Hodgkin's. Ito ngayon yung bagong name ng lymphocyte predominant, no? Hindi na ginagamit madalas ito. Nodular Hodgkin's na. Kaya huwag magpapalito. Okay? Nodular Hodgkin's is different from your nodular sclerosis. Nodular sclerosis is under classic Hodgkin's lymphoma. Okay? You have to take note of that. So Hodgkin's lymphoma is associated with this following context clues. Ito yung mga hahanapin nyo sa questionnaire ninyo. Pag nakita nyo na yan, for sure, Hodgkin's lymphoma ang case study ninyo. So, unahin natin the popcorn cells. Popcorn cells are actually lymphocytes na may multilobulated nuclei. And actually, wala silang masyadong stain. It appears as white. Kaya, tinawag na popcorn. No? Multilobulated na, kulay white pa. Okay? And then, actually, Hodgkin's then is associated with EBV infection. So, we have two types of lymphoma associated with EBV. We have Burkitt's. Anong type of Burkitt's ang associated with EBV? Yung ating immunodeficiency type. And your Hodgkin's lymphoma. Next is yung Reed-Sternberg naman. Reed-Sternberg cell has two nuclei with eosinophilic color. Ano ibig sabihin ng eosinophilic? Orange to red in color. So, drawing natin yan. No, mukha silang may mga dalawang mata. Okay? And very orange or very reddish yung kanilang nuclei. Instead of blue color, di ba ang normal lymphocyte natin, blue yung kanilang nucleus. Sa Reed-Sternberg, red to orange. So, tingnan natin yan under microscope. So, ito yung popcorn cell na sinasabi ko. Di ba mukha silang popcorn? Kulay white nga sila and multilobulated. Madaming folds. Kung convince kayo, okay? While yung Reed-Sternberg naman, yan, dalawang nucleus with red to orange nuclei. Okay? So, hindi siya, unlike itong mga to, dapat ganito dapat ang color ng nucleus niya, dark violet to blue color. But instead, no, naging reddish to purplish in color sila. Okay, balik tayo dito. Kung isa to sa mga gagawan nyo ng Manila paper, no, pagdating sa board exam, yung table na to. What are the differences between the types of Hodgkin's lymphoma? Again, the lymphocyte predominant is also known as your nodular Hodgkin's lymphoma. So, iba yan sa nodular sclerosis. Okay, the difference will be this criteria. Sa EBV infection, madalas dyan yung lymphocyte depleted type. While yung lowest, yung nodular sclerosis. Wala namang association with EBV ang lymphocyte predominant. Okay? So, yan yung mga i-highlight natin. Sa RS cells naman, ano ibig sabihin ng RS? Reed-Sternberg. Lahat present except your lymphocyte predominant. Sa popcorn cells naman, lahat walang popcorn cells except your lymphocyte predominant. Okay, CD markings naman. CD20 and 21 is associated with lymphocyte predominant only. Lahat negative. Ang CD15, 30 naman, lahat present except your lymphocyte predominant again. Pagdating sa survival rate, the best prognosis. Anong type of lymphoma ka mas mabubuhay, kumbaga, no? Yung lymphocyte predominant type. And yung worst naman is the lymphocyte depleted type. Dito ka mas madalas mamatay. Sa frequency naman, most common sa population is the nodular sclerosis. Okay? So tandaan natin yung mga mga exception to the rule, no? Kung nakalimot na kayo sa mga rules na to, the bobo the bobo choice is always the lymphocyte predominant kasi halos lahat na-fulfill niya, no, sa mga exception. Kung nakalimot lang, okay? Pero best pa rin na intindihin nyo lahat ng info dito. So that is our last slide for our WBC Pathology lecture series. And expect to have homeworks, no, the next few days para maaral natin, matest natin, or ma-evaluate natin kung naintindihan ba natin yung ating notes, okay, yung ating ni-lecture or yung ginawa nating video lecture without looking at your notes. Okay? So we will post these homeworks at siguro next week, starting ng Monday. No? Try nyo lang i-check yung sarili nyo. Hindi siya recorded pero it's a must to evaluate your capabilities. Okay? So, bye-bye and have a great weekend.